There we go.
Excellent. Excellent. We have lots of people joining us this morning, and that's wonderful. We're delighted to have you. So good morning, everyone. Bonjour encore. My name is Linda Barber, and I'm the branch manager here at the Ottawa branch of the National Association of Federal Retirees. I'd like to begin by acknowledging that the land on which the branch office is located is traditional unceded territory of the Algonquin and Anishinaabe people. On behalf of the branch, I'm very pleased to welcome you today to our webinar entitled Advanced Care Planning, presented by Compassionate Ottawa. Compassionate Ottawa is a community movement that works to change the way we think about living well, dying, death, and grief in order to strengthen the capacity of people so that they can care for each other in times of serious illness and loss. And we are very, very proud to be working with them. Today, our webinar facilitator is going to be Jenna Devaraja, who is the program coordinator at Compassionate Ottawa, and she's been our strategic partner and key contact for many years now, bringing these webinars to you. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. Today's workshop is going to have an interesting feature. We're going to have interactive elements, including small group discussions, and Jen is going to explain the details when we start. There'll be a question and answer period too, if there's time, at the end of the webinar, where you'll have a chance to type your questions into the chat box and Jenna can respond. Now, I want to give a warm welcome to anybody here who is not yet a member of the association. We hope these webinars will inspire you to join us, and to our members, we hope that these webinars will encourage you to maintain your membership. Please remember that you can invite non-members to attend any of our webinars at any time, and we encourage you to do so. After today's webinar, Ottawa branch is going to send out an email with instructions on how to access the recording we'll be doing, and this recording will simply be for the plenary session of the webinar, not for the breakout sessions. So we'll send you information on how to access the recording, more information on Compassionate Ottawa, and some of the interesting resources that they'd like to share with all the participants. So thank you again for joining us. Now I'm going to turn it over to Jenna.
Well, thank you, Linda, for the kind words. We're always appreciative to be invited back by the Ottawa branch to offer these important workshops to everyone. So as mentioned, my name is Jenna Devaraja, and I'm the program coordinator at Compassionate Ottawa. Now, typically, we do have facilitators that do present these workshops. Unfortunately, emergencies have occurred, and so I'm filling in. So I hope that I will do justice to the presentations today. So I'm going to just share with you a presentation deck that we have. And I guess before we get started, I wanted to tell you a little bit about what we intend to do in today's workshop. So of course, I'll talk a little bit about what and who Compassionate Ottawa is, and that will inform, why we find and why we think these workshops are incredibly important. We'll unpack a little bit about what advanced care planning is, and I imagine that's why you're attending today's workshop. We'll also have small group discussions in breakout rooms where you'll have a chance to kind of discuss and share and talk about your values, your wishes, and beliefs as they pertain to healthcare decisions. And hopefully we'll come back as a group and share some of those ideas together and learn from one another. I did want to mention, I think Linda had alluded to, so we're keeping everyone on mute for the time being, but as I mentioned, there will be opportunities for participation. And of course, we encourage everyone to use the raised hand function. So as Linda mentioned, we are located on the unceded and unsurrendered territory of the Anishinaabe Algonquin Nation, and we work here to pay respect to our Indigenous elders past, present, and emerging. So I think it'd be beneficial to go and talk a little bit about what Compassionate Ottawa is all about, and maybe I'll start with our history. So we all got started by someone by the name of Jackie Holtzman, who I'm sure some of you would recognize was a former mayor of Ottawa. And she met up with a really good friend of hers, Jim Nininger, who was a former CEO of the Conference Board of Canada. And they started talking about issues that were impacting them and issues that they were passionate about in the city. And they found that palliative care was a common theme and interest between them. And when they were discussing, they learned that palliative care resources in Ottawa were quite inadequate. There wasn't a lot of information and resources around. And for those of you who don't know, we only have 21 palliative care beds in Ottawa for the entire city. So Jim and Jackie wanted to learn more about this issue. How can we better support individuals? How can we better support the community around palliative care issues? What they quickly learned was that the healthcare system was not could not bear the sole responsibility of palliative care needs. They learned that the community also had a role to play in this. And so what they also learned was that the community at large was not comfortable and not knowledgeable around issues and topics around end-of-life care, around dying, death, grief, and loss. And so they thought, what better way to build a compassionate city where we can take care of one another in our last years if we can build and strengthen the capacity of the community at large. So to build and to change attitudes and behaviors, to change the way that we think about dying, death, grief, and loss, to help us, to give us the tools to be more knowledgeable and more prepared to support one another. And we do this by offering these workshops in the community, advanced care planning. We also offer grief and bereavement workshops in the community virtually and in person. We engage with diverse community groups. We work in schools, workplaces, and faith communities. We also offer webinar on topics featuring experts from the field of palliative care and compassionate communities, so we can better inform the general public around these issues. So of course, if you would like to learn more, we encourage you to visit our website at compassionottawa.ca. So let's get into the heart of why we're here today. Why are we offering these workshops? The stats here, I think, paint an urgent picture. So I think, and a reason why we are offering these workshops. So as you can see, many Canadians have thought about end-of-life care, but in actuality, only 20% have actually put that into practice in an advanced care plan. And 75% of Canadians want to die at home, but when you look at the statistics, only 60% of us actually die in hospitals. So there's a discrepancy between our wishes, what we actually want for end-of-life care, and what ends up happening. And so we are offering these workshops to address that need. You know, what can we do to change that? What can we do to better prepare Canadians to actually fulfill their wishes for end-of-life care? And how can we support one another to do that? And so we're offering these workshops. We want to kind of highlight the importance of advanced care planning conversations. And of course, we can't avoid the conversation around COVID. I think COVID was something that none of us could have predicted. It was completely unexpected. But what it did show us was that the urgency and the need to have conversations now. I think all of us have been impacted by COVID. Myself, I've known family members who passed away from complications of COVID, and we all were taken aback and were shocked by that. We weren't expecting that. And so we realized that life can be quite unpredictable. We never know what's going to happen. And starting conversations early when you are mentally capable is the best way of doing it. Now, we like to share this slide. It's actually a favorite of Jackie Holtzman's, and so we've included it in our workshop. And it's it's Charlie Brown and Snoopy sitting at the edge of it at the deck. And Charlie Brown goes to Snoopy and says, you know, someday we're all going to die, Snoopy. And Snoopy turns to Charlie Brown and says, well, on all the other days, we will live. And so that is actually what the heart of advanced care planning is. It's all about what is important to you. What are your values? What are your wishes? What are your beliefs? What are the things that are important for you for all the days that you will live, which also include your later years? And so that's kind of why we like to use this cartoon strip, because it's really about living advanced care planning. And I think a lot of us here think that, you know, advanced care planning doesn't apply to them. Maybe that they need to have a serious illness or quite frail or elderly. But in fact, advanced care planning conversations are for everyone at all stages, at any age. And as we mentioned before with COVID, life can be unpredictable. Now, we like to use this inverted triangle to show you the different kinds of healthcare conversation one can have. So at the top there of the inverted triangle, we have advanced care planning conversation. And that sets the stage for all the other conversations that come up. So advanced care planning conversations occur when a person is mentally capable, and is where they share their values, their wishes, and beliefs with their substitute decision maker or makers, if there's more than one. And this can happen at any point in your life. And as we mentioned, the earlier you start, the better. I've started advanced care planning conversations with my family, even though there was some resistance, again, because COVID showed us that life can be unpredictable and we don't know what will happen next. So having those conversations is always key, and that's the first kind of broad level of conversations. Now, goals of care conversation happen in the context of an illness. So say, for example, you've been diagnosed with a serious illness, or you have a health condition that you need to think about. This is when you have conversations with your healthcare providers and your substitute decision makers about what your treatment plan would look like, about what the impacts of treatment would be, the side effects, discussing what you would be willing to go through or not willing to go through. So that's when you would have goals of care conversations. And again, those advanced care planning conversations you would have had earlier inform your goals of care conversations. And then of course, lastly, we have the consent for treatment of care. So this happens at the precise time of treatment. So say, for example, you're going into an operating room, that's when you get the consent to go ahead with something, whatever other healthcare treatments, you would get that consent. And in Ontario, the law requires that healthcare providers get informed consent or refusal of consent. And that healthcare provider needs to provide the full list of the benefits, the risks, the side effects, and also alternative treatment plans as well. So the healthcare provider needs to have that conversation, and then from there, get that consent if you would like to go forward or not. And you are within your right to refuse treatment, of course, as well. Now, the only time when informed consent is not needed is in emergencies. So say, for example, you're unconscious, a paramedic arrives, they will provide life-saving treatment to reduce suffering or to save a life, and they don't need your informed consent in that particular instance. But in all other cases, consent needs to come from a person. And I would like to make it clear that it can't come from a piece of paper. So even if you have written out your values, your wishes, your consent, what you would want to happen, if you're unconscious and you're unable to speak to someone, a healthcare practitioner or provider can't rely on that piece of paper to confirm consent. They're going to go to a person. So if you're not able to speak for yourself, they're going to go to a substitute decision maker or someone who can make that decision on your behalf. So in summary, the advanced care planning conversations are the ones that inform all the other conversations that you will have as they pertain to your healthcare. So it is very important that you really think through about your values, your wishes, and beliefs, and start the conversations as early as possible. So if there's anything that you take away from today's workshop, is that there are two main components of an advanced care plan. The first is that you need to confirm your substitute decision maker. Who is that going to be? It could be one person, it could be more than one person. And we'll talk a little bit about how that's assigned and who that person would be for you. And it's also important that once you know who your substitute decision maker is, that you have the conversations. So many times I talk to individuals who say, oh yeah, I know my husband, he's my substitute decision maker. And then I talk to them like, oh, well, have you talked to them about your values, wishes, and beliefs about what you would want for end of life care? And usually there's a blank stare. I mean, they haven't had those conversations. So it's good to know who your substitute decision maker is, but it's also equally as important to actually start the conversation so they know they have the information to make the best decision for you. Now, I think something that I think really highlights the importance of an SDM is this wonderful story that I'm going to read out to you from Dr. Atul Gawande's book, Being Mortal. And for those of you who don't know Dr. Atul Gawande, He's a palliative care doctor in the States. He's done a number of talks and written books on this topic. I would highly recommend that if you're not familiar with him, that look him up. He has some accessible videos on YouTube and some books that you might be interested in, including Being Mortal. So in his book, he talks about a story about his friend Susan, whose dad was facing a decision to have a surgery to remove a tumor from his spinal cord. Now, there was a 20% risk that that would leave him a quadriplegic. So Susan was her father's SDM, his substitute decision maker. So before the surgery, she sat with her father and talked to him and said, if anything was to go wrong or anything terrible was to happen, how much suffering would you be willing to go through for the sake of simply adding, more years to your life or more time? What if something went awry and you were to become a quadriplegic? And he just went to her and simply said, I can endure a lot of pain. That doesn't trouble me. I'm willing to undergo almost anything as long as I can still watch football on television and eat chocolate ice cream. And so she was a bit flabbergasted by that. Her father was a distinguished professor of psychology, and she wasn't expecting to give that response. So she's like, okay, all right, fine. So she just took that as his wish. Now, the next day when they went to the operation room, he went in doing well initially in the operation. But unfortunately, at some point, there was a complication, and the surgeon came back to Susan and said, we'll need to bring him back to, we'll probably need to bring him back to the operating room, but the likelihood of him being a quadriplegic is pretty much guaranteed. Do you want to go forward with the surgery? And she thought about it for a minute and then realized that she had the answer. And so she turned to the surgeon and said, so if he comes out of quadriplegic, will he still be able to eat chocolate ice cream and still be able to watch football on television? And the surgeon said, yes, of course he can. And so she signed off and agreed to continue the next round of the surgery. So if Susan hadn't had that conversation with her father, she would never have really known if she had made the right decision. So if he had become quadriplegic, and for example, what if he couldn't speak to her after the operation? She may not know that was, he was quite comfortable. So if he had passed away and they did not do the surgery, she would go through her entire life not knowing if that was the right decision for him. And so by simply having that conversation with her father beforehand, she was able to identify, yes, I did make the right decision, and it relieved some of the burden from her as well. And so I think that we like to always ask all of our participants this is that, what are your, chocolate ice cream and football must-haves? And I like to bring up those 2 points is because not everyone will know what those would be. I mean, Susan in this case didn't realize that was what her father wished, and that would bring him a comfortable life. So perhaps, what you think might be really obvious to your family may not be. So having those conversations, identifying for yourself even as well, what are my chocolate ice creams and football must-haves? What's really important for me in my last days that would make me feel comfortable? So those are some of the things that we would encourage everyone to think about. So we're going to go into a little bit of a game. And now it's too bad that we're not in person, because we do have a deck of cards that we would use that have statements. And actually, I'm going to just flip to the next screen here. And so the deck of cards is 36 statements in the deck of cards. So each card has a statement. And what we would do is have these cards face up on a table. And we would ask individuals and participants to choose a statement from the cards that would really resonate with them for what they would want for end of life care. And it was interesting. We thought that maybe one card would be coveted by all the participants, but we noticed that everyone had their own different selections. We all have our different understanding and perspectives as to what we would want for end of life care, our last days. And so I encourage you all, maybe we'll take a few moments here to look at the list that we have here. And so hopefully everyone can see this clearly. I know these are small, like sometimes small font. But for example, the first one says, to have my family with me. Is that important for you? Is that incredibly important for you? to meet with clergy or chaplain. Faith communities, as members of a faith community would find that equally important. And as we talked about, not being a burden on my family. So what does that mean to you? Is that also be very important to you? So I would encourage you, I'll leave this on for a minute or so. And if you have a piece of paper and a pencil or a pen, I would encourage you just to jot down what you think really resonates with you. Write that down. And then what I would like us to do is to take that statement with us when we go into the breakout rooms to share why we chose that. And it's really interesting that to hear different perspectives, and sometimes they inform our perspectives as well, to hear what other people are thinking and going through. It might inform some of the decisions we might make for ourselves as well. So take a minute. I would encourage you all to jot it down. I'll leave it on for a minute or two just so everyone has time. And in a few minutes, we'll go into our breakout rooms with a small group, and we'll discuss this. You can discuss this with your group as to why you chose this particular topic, a particular statement, sorry. Queries or comments from individuals, I will move forward. And so just slipped ahead there. So I guess our next item that we'd like to talk about is maybe starting the conversations. How do we do this? Again, like we mentioned in the resources, we have a comprehensive resource guide, and we do talk about ways in which you could start the conversations. And there are a few ways, and we've kind of maybe touched upon some of them here today already. So you can be straightforward. Sometimes you can be quite direct. I need your help with something, or just say, hey, my health is not doing really well right now, or I think my health may not be good in the future. I need to have this conversation with you right now. Let's start that conversation. So you could try that approach. It may work with some individuals. You can also blame someone else or find an example. So for example, say, I was at a workshop today at Advanced Care Planning, and there was some information I learned. Can I share it with you? And then from there, ease into that conversation about your own values, wishes, and beliefs. And we also like to use the example of the news. COVID has been one of those situations that have, in a way, made it easier for us to talk about these issues. It was unpredictable, and I imagine many of you here have been impacted by COVID in some shape or form. Talking about how life can be unpredictable, and maybe having the conversations now while you are mentally capable, and using COVID or other news stories as a way to kind of ease into the conversation could be one way. And again, the resources that we sent later today go into some more options as well that can be helpful for some. And I know some individuals here may have family who are resistant, so we hope that those resources will be helpful to you. Now, we did want to talk more about substitute decision makers. So imagine you're at the hospital too ill or too hurt to speak for yourself. Who is that person that's going to make that decision for you? So as we mentioned, that is going to be your substitute decision maker. So if you're living in Ontario, the law, there is already an assignment of who your substitute decision maker is. So automatically you already have an assigned substitute decision maker based on this hierarchy. So typically that goes spouses first, children, family. And so if you are unable to make a decision for you, a healthcare practitioner would go to that first person on that hierarchy. So they would go to your spouse, for example, or to your children, or to a relative of yours to make that decision. And so again, very specifically in the Ontario context, no consent without capacity for treatment will be provided. So treatment will not be provided without explicit consent from that individual. So again, I'll speak only to the province of Ontario. It does differ from provinces. And so when you're looking at your substitute decision maker, you want to make sure that they're someone that is going to honor your wishes and beliefs, even if they differ from their own. You want to make sure that they're a strong advocate. You want to make sure that they're someone who be comfortable in healthcare situations, someone who's calm in a crisis, and who's able to handle conflict should it arrive. So As I mentioned, all of us already have an assigned SDM according to the hierarchy in Ontario. You want to make sure also that this person is, of course, over the age of 16, is willing to take on that responsibility. So sometimes, even if you have an automatic assignment of an SDM, they may not want that responsibility. They may not be comfortable. So you need to figure out if they are or are not. And that they are accessible. So you want to also make sure that your SDM is close by, ideally. You don't want to choose someone. So say, for example, your assigned SDM is your daughter and they live across the world. It'd be ideal if that person was closer to you. So you may want to think about choosing someone else. So this is kind of where our next slide comes in around personal power of attorney for personal care. So as we mentioned, everyone has an automatic SDM. Now, for whatever reason, if you think that person who's your automatic assigned substitute decision maker will not be a good fit, and there could be a number of reasons why that could be the case, you can choose someone else and issue a power of attorney for personal care. And so what you would need to do in that case is fill out the form. So as mentioned, after today's workshop, you'll get that form from I believe it's from the Ministry of the Attorney General, the Ontario government. So there's a form there that you can fill out. All the information's there. Again, you can do this with a lawyer. You don't need to. You just need to sign the form and have 2 witnesses sign and sign off as well on the form. And so the power of attorney for personal care can be a really great option for those of us who either feel like the assigned SDM is not aligned with our wishes, values, and beliefs. So for example, I've talked to so many spouses that say, oh, my husband does not want to talk about these things. He gets scared. He doesn't like, want to even think about it. And he wouldn't handle a crisis well. So you know what? I've assigned my sister as my power of attorney for personal care. And that was a conversation they had and they assigned that person. So, and it can also be a great option for those who don't have a family nearby or have family at all. And so you can choose a neighbor, a friend, a caregiver. And I think this is kind of the limitations of the hierarchy in Ontario. It doesn't include these individuals, but that is where the power of attorney for personal care comes in to offer you that option. And again, this has come up in many of our workshops, which is why we've included this in our slide. Many older adults do live alone for whatever reason. And so we want to also make sure that they are equipped to find someone who could be their substitute decision maker. So as we mentioned, we work with apartment buildings aging in place. Their coordinators are fantastic. So talk to individuals within your community, so community networks. Talk to your friends. I know this wonderful story where in a book club of older women, they were talking about power of attorney for personal care, they were talking about advanced care planning. And one individual said, I don't have family. I don't even know who my substitute decision would be. And she found out in that group of friends that one other woman also was in a similar situation. They started connecting, talking about their values, wishes, and beliefs. And they came to realization that their values, wishes, and beliefs were very much aligned and said, you know what, can we be each other's power of attorney for personal care? And they wrote it up. So they went and got the forms and listed. So they are now each other's power of attorney for personal care. And they felt very comfortable with that because they knew that they would respect their wishes. So there are different ways that you can do this. It doesn't have to be through the traditional routes. Talk to your community, network with your neighborhood associations. There are ways and people who are there to help you with that process. So I just want to go very quickly before we end off on today, the steps for advanced care planning, which we've kind of alluded to here already. So I guess the first one that we really want to highlight is the thinking process. We need to identify what is important to us, what are our values, wishes, and beliefs. Really think it through, unpack. That's why we introduced those 36 statements. Really pick that statement, say, why did I pick that statement? Why is that so important to me? Really unpack that and think about it. Learn about your overall health. And again, this is where you can learn about the medical treatments. If you are diagnosed with a particular illness or you think that you may be, you might want to learn about medical treatments that you'd be willing or not willing to undergo and think about, where you stand. and then decide who is going to be your substitute decision maker. Is it going to be more than one person? So for example, if you don't have a spouse and you have children, you have 3 children, are you going to equally give all those kids capacity to make decisions, or are you going to assign one of your kids who will be aligned with your values, wishes, and beliefs? And you can do that. So who you're going to decide, are you going to create a power of attorney for personal care? And then of course, talk. So even after you decided, have the conversation, talk about your values, wishes, and beliefs. What's important to you? And then record, as someone said. It's actually very important that you record the information because there can be a lot of details that we may not remember. Record that information so that your substitute decision makers can be better informed to make the right decision. So as a final recap, start the conversation. It's never too early. I encourage my friends who are my age to start the conversation. We never know what's going to happen. Decide who that person is going to be for you, your substitute decision maker, who's going to value your wishes, your values, your wishes, and your beliefs, and put together a plan. Write it down. That would be incredibly helpful as well. So that concludes our workshop, and I know we're just running out of time. I will turn it to Linda. I know that she had some concluding statements that she'd like to make, but I want to thank everyone for attending today's workshop. I know it's not easy subject matter. I know there's a lot to think through, but we are so thankful that you've come in to learn more about this, and we hope that with the resources we give you, that you'll be better prepared to make some decisions and start that process. So thank you so much, and I'll turn it to Linda.
Hi, I'm not Linda, but Linda unfortunately lost her connection, so I'll be doing the final speaking for today's presentation. So I just want to thank you, Jenna, for the wonderful presentation. I think everyone here can agree that this was wonderfully informative and that you did an excellent job even without your facilitators present. So thank you again. And thank you everyone here for participating. We hope you learned a lot. And a reminder to look out for a follow-up email. So that'll include the resources and the forms that Jenna was talking about earlier. And it'll also include the recording of today's webinar, minus, of course, any personal information and no breakout room talk. So just the information shared by Jenna, should you wish to view it again. And just a final reminder, you can invite non-members to attend our webinars and try us out as guests. So that always helps. That helps our numbers, and hopefully, you can share these wonderful webinars with people that you think might be interested. So to register for any upcoming webinars that we have coming, please visit the Ottawa branch website, and we'll make sure to include that address also in the follow-up email. So thank you so much, everyone, and see you at our next webinar. Merci beaucoup et au revoir. Bye, everyone.
Au revoir.
Thank you, everyone.
Thank you.